Good afternoon slash good night on this Wednesday night. So, headed home like all the other Wednesday nights. I'm ugh, gonna try to make this one a little bit short and sweet, to the point, so to speak. Um, just kind of a rough week at work. Had a bunch of crazy things going on with patients, staffing, all of the above answer choice, so to speak. And then obviously I can't be very specific because of HIPAA violations. But definitely an interesting but long week. Um, which one thing this week, kind of in the good side of things, got to talk to Dr. Patel, who's an infectious disease doctor. And I was just talking to her about the nurse practitioner program. I had a question about about some epidemiology stuff, and I figured, what better person to ask than the infectious disease doctor, who basically is an expert in epidemiology and the treatment of bacteria, viruses, XYZ. And she was just kind of talking to me about it, and then we just got on the subject of what I wanted to do after I finished the nurse practitioner. And I was like, well, I've seen the clinic side of things, like health departments, urgent care, all these things. And it's just not for me. I don't feel like it's just not my cup of tea, so to speak. And then I don't think I want to do primary care because of the way primary care is kind of structured for the most part. So I'm looking at, the hospital side of things, and that's honestly where a good chunk of money is anyways. It's always been that way. Even if you're just going for nursing, like RN status, usually the most money is paid at the hospital side, and then from there you go into like a specialty area, and then that's the highest paid. So what I'm realizing, as I'm getting closer to finishing this nurse practitioner, I'm looking at where exactly do I want to fit in at, and my more and more leaning into specialties. And admittedly, even before talking to Dr. Patel, I was already kind of looking at specialties, and infectious disease is a specialty that I was kind of looking at because it's very interesting as far as the pathophysiology of it and everything. Kind of like you figure out, like, oh, we do these gram staining tests to see, oh, is it gram positive? Is it gram negative? Oh, does the microorganism have a cell wall? Does it have the cell membrane? Does it have this certain protein enzyme? Because based on all these things, you would use different antibiotics and medications and routes, and based on where this bacteria is presenting from, you would do antibiotic therapy for X amount of weeks. And it's almost like you're kind of like solving like a little mini puzzle, in a way, like you're investigating the crime scene, so to speak, of the bacteria. So it's kind of interesting in a very nerdy healthcare way. The other specialty that I'm really looking at, because I just enjoy it, is general surgery. So I've worked, obviously I worked as a medic in the Army, EMT paramedic, got my RN. I first started working in the ER did a lot of triage in the ER. And then from there, at one point, I was looking at doing my MD, as I've mentioned in another video. So I switched from just working ER to working as like a different hospitals and administrations call it different things. My home hospital called it SWAT nursing. A couple of the different travel places I've been to call it CRD. I think it's like something about resource division, like critical resource division, I think is what CRD stands for. But no matter what it's called, it's basically just saying it's a fancy title they give to people to basically say like, hey, this person's trained to work in every department in the hospital at a very high level. Like, you're not float pool. That's what I'm getting at. Like, you have your float pool, and then you have this, like CRD or SWAT or whatever. Because a lot of times, if you're in that CRD or SWAT or whatever your hospital calls it, you're not only like floating to the different floors, but you're floating to the critical care places like ICU, ER, but you can also go to med-surg and ortho and obs and, go down maybe even to the cath lab. And so you're just trained to be anywhere and not only be efficient, but you're actually a lot of times trained to charge, meaning, you're trained to not only be able to work in those areas, but actually lead a team in those areas. And before I started traveling as a nurse, that is what I did at my home hospital. And even as a travel nurse, that's basically kind of what I've done. Usually I'll go into a hospital and, I'll just start as like a regular travel nurse. And then all of a sudden, let's say they're missing a charge nurse or something like that. And a lot of times they'll look at, okay, well, who has management experience? Who has charge experience? Who's our best nurse on the floor? Who's the one that everybody goes to when they have a question? And that's who kind of gets deemed to be the fill-in. And because of my background and the things I've done in the past, a lot of times that has become me, even on my travel assignments. So, and I've kind of gravitated towards surgery, both critical care surgery, like emergency surgery, just general surgery. And I like the complexity of it. I like, I guess, kind of that that nerdy complexity of the pathophysiology of, oh, this person has colon cancer, so we're going to basically take this section of colon out. We're going to reroute it, put a temporary colostomy so that, everything can heal up and they can still, get rid of their fecal matter and stuff like that. And then we're going to later, take out that colostomy and get it back to like a normal functioning without that section of colon. And, or like, let's say someone's got ascites and they need to, like, reoccurring ascites. It's like, oh, well, instead of this person coming in and having to get like paracentesis all the time, they might consult like the general surgeon to do, or interventional radiology sometimes also, for like a Denver drain. And then all of a sudden now with the Denver drain, they're able to get home health supplies and do it at home. It's just amazing, some of the stuff that's there. So that's another specialty area I've looked at. Obviously you got cardiology with the heart, and you got your stents, and Well, depending on what level of care, cardiology, I mean, they might be doing open heart surgeries. It might be stents and heart casts and pacemakers and defibrillators, or it might just be like a very general cardiologist where you're just, working with people with hypertension, high cholesterol, and kind of like the history stuff, but not the interventional stuff. Then you got your nephrology, that's your kidneys. You got your gastroenterologist, that's your gastrointestinal tract. That's usually the people that do your EGDs, colonoscopies, stuff like that. But your general surgeon is kind of the jack of all trades for any of that, So it's kind of, it leaves you to have a little bit of variety. And I think that's one thing that, as I've progressed through my healthcare journey, that is something that I've always liked, is I've liked having options. So, and I think that's why I did CRD, SWAT, whatever you want to call it also, is because I was able to, let's say I'm working ER triage for like 3 or 4 days, and I'm just like, I'm kind of tired of working triage. Let me go work the unit for a little bit. I'm kind of tired of getting freaking vent patients. Tired of the vents. I'm tired of, I want to actually interact with people and, just see something different. Then go to like the med surg for a while. Med surg floor. Then it's like, okay, I'm kind of tired of the med surg floor. Let's go to peds. Then I'm, over there going to pediatrics, hanging out with the kiddos and treating the kids and dealing with the parents and all that. And I will say I love pediatrics. That's definitely a specialty that I like. But I do not think I will choose that specialty because of dealing with parents. That is because of the background that I have with my own childhood and stuff like that. Oh, man. Throat got a little dry spell all of a sudden. But because of the childhood that I grew up in and stuff like that, seeing child abuse and neglect and things of that nature it just triggers something in me. So I don't think I'll be going to that specialty because I don't know. I just don't think it's the best option for me long term for my own mental health because of my childhood. Dabbling in it maybe a little bit here and there, but nothing long term, I don't think, for my own mental health. There's also sleep medicine. Sleep medicine is one that I'm looking at pretty good. Also, I mean, as a family nurse practitioner, obviously, I'm just looking at hospital stuff and specialties because I feel like that's where I'm gonna go. I'm basically 90% sure that's what I'm gonna do, and then I'm probably going to do some PRN clinical work / something with the college, because I do love to teach, and especially on the clinic side of things, like in the hospital. For instance, when I was doing my bachelor's in nursing, I was actually tutoring the ASN students at the STEM Center while I was doing my bachelor's in nursing, and I loved it. And I was actually really looking at doing nurse education at one point, but to be honest with you, the nurse education pay is hot dog water. I mean, it is atrocious compared to other fields, if that makes sense. I mean, if we're just looking at pay, just looking at straight pay, but the scheduling, I mean, you can't beat the schedule. That's the selling point of like nurse education is the schedule. Most colleges, you work Monday through Thursday. You have a 3-day weekend every week. You're off all major holidays. Most colleges, you would be off during the summer unless you choose to do summer classes and teach them. The benefits, like healthcare benefits and 401k and all that kind of stuff, it's just amazing. On all of those fronts, it's amazing. But when you're just looking at the actual pay, like what am I bringing home to pay the bills? I mean, if you compare that to a nurse practitioner, because to teach nursing, you have to have a degree higher than what you're teaching. So for instance, like if you're going to teach RNs, your RNs are, ASN or associates and bachelors. So you have to have a master's at least. And a lot of colleges want you to have a doctorate in nursing. So, I mean, that's like another year of school to get a doctorate in nursing just to teach. And then, a nursing educator that's just working at the college is probably making somewhere between 80 and 110 a year. And that's with a doctorate versus, a nurse practitioner working as a hospitalist or as in certain specialties. I mean, you're looking at making around 110 to 150. You're looking at $30,000-$40,000 difference, and that's a master's degree. So you're talking about a master's degree making almost $30,000 or even more dollars per year compared to a doctorate degree. It just makes it almost where it's like, what's the point of getting that doctorate to make less money? And in my head, at least. The more I look into it, maybe there is some other things I'm not looking at or XYZs. I'm sure there is, because there's people that are doing it. So, so there's people that's doing it. So obviously it's a thing, so to speak. But looking at all that, I'm just not convinced on going down that path because of the way the pay structure is pretty much set up. And I think the problem is that as a nurse educator, they don't compare you to other specialties in nursing. They compare you to other educators. So when the college is looking at paying a nurse educator, they compare you to, the history, the biology, the liberal arts, the literature. Like, they're comparing you to those other instructors. They're not comparing you to a hospitalist or an urgent care nurse practitioner, or they're not making that comparison. They're making the comparison of you versus this other teacher. And then when they do that, it's very hard to win the argument of, oh, well, I'm a nurse educator, I should be getting paid $150,000 per year because I have a doctorate in nurse education, and doctorate level nurses in other specialties are making $150,000. Because, that college is probably going to clap back at you with, oh, well, we only pay the liberal arts teacher $80,000 a year. Well, how are we going to pay you double almost? That doesn't make sense. Like, that's what they're looking at. So you're looking at two different spectrums, and that's basically the problem with the nurse education pay, in my opinion. Just from the outside looking in. Admittedly, I'm no expert in that area because I'm not in it. But from the outside looking in, I feel like that's the glaring issue. But I always have told people that nurse education will probably be my semi-retirement job because of the schedule and benefits. So I think I'll get to a point in life where I'm probably not wanting to do the hustle and bustle as much. And once I get to that point, that's probably when I'll slip into that nurse education role and just teach the next generation and enjoy that, cush schedule. I mean, maybe that's what I do. That's kind of definitely something I've looked at as like my semi-retirement job, because I don't think I'll ever retire. Like, as cliche it is, and I definitely have my ups and downs with the healthcare system and nursing and all these things. At the end of the day, I love what I do. I love helping people. I love the nerdiness of it. I get around other people that are like-minded and love what they do. And if you've ever hung out with like emergency room nurses, especially if it's like an all-male crew in the emergency room, which a lot of them are, I mean, it is it's just a different environment. And or I mean, even the females, as crazy as this sounds, because I mean, like, for instance, like, I'm on a 36 bed unit. There's, let's see, I think there was like a total of like maybe 15 staff, including myself, on the unit today. I mean, I'm counting like nurses, hucks, techs, everything, like 15, 16 staff. And then if you start counting auxiliary staff, like case managers and stuff like that, yeah, probably the number probably jumps up to 20. So out of the 20 staff, I'm the only guy. Like, I got a 1 on 20 odds, so to speak. And I'm telling you, guys, we think that we talk dirty and have these nasty thoughts or say, screwed up stuff. But some of these women have the craziest jokes and stuff that I have ever heard. And I mean, I was in the Army cutting up. I was in the ER with an all-guy crew, and we would cut up. And I'm not gonna lie, some of the stuff I've heard some of these females say, I'm like, holy crap. Like, it just reminds me of like being in the field with the guys when I was in the Army. I'm like, dang, like, I could actually chill with this female, because like, she's just so in that zone where she's like just BSing. And I don't know, it's like a different vibe than and then obviously you do have your some nurses that are very uptight and stuff like that, and definitely if you say something wrong to them, you're going to wind up in like an HR visit. But I mean, those are very easy to identify, to say the least. But you have some females that, like, you can cut up, joke around with, and you don't have to, and they'll give it right back to you. Like, we have one, she's our huck, little short black lady. I think she's like 40, 41. And I jokingly, her name's Shadrika. I jokingly call her DJ Rika. And I talk about how she's working as a DJ on the weekend, and like, because she's our desk secretary, so she's always picking up the phone like, hey, what do you need? How can I help you? Da-da-da-da. So I pick on her about being the disc jockey of the unit, like how she's over there always flipping the phones and going to this, going to that, and that's how it got started. But she had this, she changed her hairstyle, and she had like this little kind of fro thing going on, and jokingly I was like, I pulled up a picture of a Chia Pet, like the toys from the 90s, and And I showed it to her. I was like, hey, this is what your hair reminds me of right now. And she just, just starts dying laughing, cutting up with me. She gave me some jokes back. I can't really say exactly what she said. So I was joking with her about that. Then later on in the day, like I said, she's like, I don't know, I'm gonna say like 4'11" or 4'9" or something. Like she's very, very short stature, but just bigger than life personality. And I was doing something in the hallway, and she's like, "Move out my way." And I look back and I realize it's her, and I'm like, "All right, little Ludacris, little Luda," and she's giving it right back to me, ribbing me back, and so you get around certain females like that they can give it back to you. Obviously, you get a variety in the healthcare field. You got some that you don't joke with because they're gonna snitch. Those are but like I said, you'll identify them very quickly. So I like the people I'm with. I love the healthcare field. I've always been somewhat of a nerd. Like, I'm not to be braggadocious. I'm naturally gifted when it comes to school. Like, even in high school, I was that kid that could basically sleep in class, wake up, take the test, make an A, turn it in, and go back to sleep. Like, I've just always been that person. Like, I completed my EMT, paramedic, and my associate's level of nursing, and my bachelor's level of nursing, and I've done already I got a year left on my master's in nursing, and I've honestly never have read a chapter in any book, studied any book or anything, except for one book, and it wasn't even a healthcare book. It was a book on like test taking strategies, and I remember reading that cover to cover and doing some practice questions and stuff like that, and trying the tools that it talks about in that book. But the entire time that I did EMT, paramedic, RN, BSN, and even this MSN that I'm in now, I have like an actual textbook. Never read it, like not cover to cover. I've attempted it just to try. It's just not the way I learn. Like, I read the one time, for instance, that in my master's degree program right now, the one time that I actually read 2 chapters of it and did like just a practice test kind of thing, I basically scored like a 76 or something like that. Then I went back just going through the PowerPoint, looking up, and just doing the lectures. Like, if the professor puts on lectures, just going through the lecture PowerPoints with the voiceover. And then if there's something like, I kind of didn't understand the way she explained it, just go on YouTube, watch, Osmosis, Ninja Nerd, one of those kind of people, watch them talk about the pathophysiology or the kind of nerdy breakdown of it. And then it's like, boom, got it. I watched the video one time, it clicks, I got it. Like, it's in there. I don't have to worry about it. Take the test, make a 94, 98, 100, who knows, like, it'll be somewhere in the 90s. But it's like, every time I've ever attempted to like read the chapters to study or whatever, it's just been a waste of my time. So I just don't do it. I just go to the lecture, especially if it's an in-person lecture. I'll print the PowerPoints off the day before, go to the lecture, listen. If there's anything that I think is important, I'll just underline it with my pencil, I would print the PowerPoints off where you have the 3 PowerPoints on the left side, and then you have the little note section on the right side. And if there was ever anything that I thought I needed to look into, I would just make like a little quick note to myself on the little note section, like look up epidemiology / gram staining test. Because, like for instance, like when I talked to Dr. Patel, I didn't, the gram staining stuff was kind of throwing me off for whatever reason. It just, I don't know, it was just the way it was explained in the voiceover or whatever didn't fit right with me. And then also, being in the healthcare field as a travel nurse, I'm around a lot of specialties, like pulmonologists, infectious disease doctors, general surgeons, vascular surgeons, cardiologists, nephrologists. So a lot of times, like if there's a concept that I'm not jiving with, like I have like a resource in them in a way. So I can just be like, hey, instead of me trying to figure this out by reading this chapter, how about I just network the people around me and just be like, oh, I don't understand this one thing about gram staining. Like, how does that help me determine which antibiotic I'm going to provide for this patient? Oh, let me ask the infectious disease doctor who specializes in this. Like, they're like the subject matter expert. So I ask, Dr. Patel, she explains it in depth to me, breaks it down. I'm like, oh, okay. So, and I, say it back to her to make sure what I think I understand is correct. And then we get on this whole subject. And basically, because she sees that I'm trying, I'm showing interest, and I'm actually understanding advanced concepts around this specialty, she's like, oh, well, you know what? Like, have you thought about doing infectious disease? Like, I might actually have a job for you when you graduate. And if I don't, I have these other contacts that are already actively looking for nurse practitioners right now in the infectious disease sector. So it's like, by me networking, it's not only allowing me to, figure these things out, but it's also like, oh, this person later on might help me get a job or might even hire me because they know, like, I'm interested in this area, or I've already studied this area to an advanced level that they find acceptable. And again, that's just networking. I remember about a week ago, someone asked me about something about an interview because they had an interview. They were leaving this hospital, and they wanted to put me as a reference. And then they were asking me if I had any tips on interviews. And I had to basically tell them, like, I don't have any tips on interview. I've never been interviewed. Ever. Like, every job that I've had, I pretty much have basically transitioned into. I joined the Army right out of high school. Obviously, there's not really an interview process. I mean, you just take the ASVAB, you score high enough, you pick whatever job you're qualified for based off of your ASVAB score. They send you to school, they train you and everything in it, and you work your butt off, and there you go. Went to EMT as I was in went to EMT as I was a combat medic in the Army. I didn't even really use it. Paramedic, same thing. I was a combat medic in the Army. I just went and got the paramedic because I wanted more education. And while I was in there, the hospital administrator, or he knew an administrator, something like that, asked me about just doing some moonlighting, like whenever I had, like, let's say a 3-day or 4-day weekend with the Army because of holidays. He's like, hey, if you ever want to pick up a day on the truck, let me know. And I just let him know, and I started picking up days on the truck as a paramedic. When I was in nursing school, I did my clinicals for my RN, and like about a month into my clinicals, I had 2 different hospitals in the ER reach out to me and offer me jobs while I was doing my clinicals. And I accepted one. When I transitioned to the SWAT/CRD, I was already basically leading the ER. I was doing triage by myself. I was like the relief lead for the ER, and I had already floated over to ICU a couple times prior to even applying for it. So when I just asked, I said, hey, I'm thinking about getting my MD. I'd like to, look at doing CRD is what I told she's now the VP, I think. At the time, she was just like over all the nurses. And she was like, okay, well, let me look. Calls me the next morning. Is like, hey, you start next week. You'll be doing a full thing in ICU, and then you'll go to medical, then surgical, then peds, then the obs, and a little bit in the cath lab. And you'll be ready by the end of 3 months. And that was it. As far as the travel nursing, I literally just put my travel nursing packet together, so to speak, with all my certifications, like my nurse's license, BLS, ACLS, PALS, NIPS, all those things, showing that all my stuff was up to date, all my vaccines were up to date, yada, yada, yada. Picked locations that I thought I wanted to go to, submit my packet, and they would just basically look over my packet and go, all right, when can you start? Packet approved. You start XYZ day. And then, now it's like with me transitioning to this nurse practitioner position, I've already had a job offer with the general surgery group. One of the biggest general surgeons in the Warner Robins, Macon area has already offered me a job, told me exactly what I would be doing, what he would be paying, what the bonus structure looks like, and everything. And I don't have to apply. Like, basically, I graduate, tell them I want the job's mine. Same with the infectious disease doctor that I'm mentioning. I graduate, get my license, tell her I want the job, it's mine. Like, the vascular surgeon kind of made an offer to me after I graduate, but kind of didn't in the same way. Like basically kind of threw something out there to see what I don't know, kind of threw something my way, but at the same time, it didn't feel as solid as the first two that I mentioned. So, when I graduate, I'll probably... Oh, and then another one is one of the resident doctors who's finishing residency this year also is planning on doing sleep medicine, and he's going to be needing a nurse practitioner and stuff, and me and him, we mesh very well together. He used to be a nurse, and now he's finishing out his MD. He's going to be doing sleep medicine, starting up his own sleep study lab and everything like that. That's what he loves to do. And me and him get along great, and he's basically was like, hey, I'll pay you, we'll start off at like $120, a year, which is the national average for like sleep medicine is like $126, I think. So he's like, hey, we'll start off $120, and then we'll go from there. And then as the practice grows, if you want to invest in the practice, there will be options. Or if you just want to stay at like the 120 and just stay with the business side of it, or just stay like on the employment side of it, then that's fine too. If you want to try to get in with the investment side, there'll be those kind of potentials and stuff like that. And that job is a lot of telemedicine, really. Like, I wouldn't have to necessarily see people in the office or at the hospital and stuff like that. So that'll be a pretty cush job in a way. So I've looked at that a lot too. And yeah, and then the general surgeon was definitely paying more. I mean, I'm not gonna say exact numbers because I don't know if he wants me to put that out there, but I'll just say that it was so far it's been the most competitive between him, the vascular, and ID pay wise. They're the top three so far pay wise. And then the sleep medicine seems to be the best option as far as workload. And admittedly, infectious disease would be like right behind the sleep medicine with workload. The general surgery, vascular surgery would be the highest workload, but honestly, probably the highest paying potentially on the employment side, not counting any investment stuff with it, just strictly, salary based. But yeah, that's all in this video. I actually went a lot longer than I thought I would. But y'all have a good night. Get the wife and kids, if you have any, give the kids a big hug, kiss, slap the old lady on the butt, let her know you love her, and just enjoy the weekend. I'm going to try to knock out some papers and quizzes and whatnot and enjoy mine. Y'all have a good night.